Okay, it's a beautiful day because Miss Mary is going to have a perineal care. But first, let's begin with what the supplies are. So this is going to be a wet activity. Like I said, every wet activity, you'll have your very first big towel as the table barrier. Now you have two of these big towels and also a disposable bed pad, chat pad, disposable incontinence pad, and these are two pairs of gloves. This is going to be for the front side, for the back side. You also have four of these, and these are going to be colored 1, 2, 3, and 4. Definitely have your soap, and definitely you also have your basin. As soon as you're done, put it to the side, and you will then begin, Mr. Proctor or Miss Proctor. I'll begin with my skills. Ready to wash my hands, knock, knock, knock. Good morning, Miss Mary. My name is Sergio, and I'm your CNA for today. I'm here to assist with your perineal care. May I come in? She says yes, and I'll go inside. Miss Mary, let me check your wristband here, okay? Definitely check for the wristband. Okay, that's good. And I'll close the curtain for privacy of Miss Mary. Wheels are locked. The bed is in the lowest position. Cold lights. It's within reach of the resident. And Miss Mary, I'll be right back. Let me just gather my supplies. And then I'll push it a little bit closer here. This time, what I'm going to do first is I will be raising these blanket up here. Okay, somewhere there. So it's about halfway. Okay, it's going to be on that side. And then at this point, I will just going to be putting on, checking my water. That's good. Miss Mary, can you please check the water as well? Okay, that's good. She says it's perfect. And then I can go ahead with the regular steps. And I'm going to put my gloves on. Then another gloves on the other side. And I'll hold on to this bed pad or disposable bed pad, and I'll do my fan fold style. You can choose whether you're going to turn Miss Mary to the side or you can just insert underneath her. Okay, so I decide to just insert underneath her. Miss Mary, can you raise your hips, please? And she did that. I'll put it underneath, and I'll make sure to mention it's properly placed and it's unwrinkled. Those are very important. Okay, so at this point, I'm going to bring this closer here, and I'm going to go on the side. And what I'm going to do first is I will go for the very first towel, washcloth, wring that, soap, and then lather away from the water. And here, with my left hand, you're too far, you can close here. You lift this, and then you can begin. So it's going to be from front to back, front to back. You don't have to do the hand mitt. It's going to be, where's the front to back? There's the front to back. That's going to be for the side, and then you will switch to the other side, front to back. And now this is going to be for the middle. This, when you do it for the middle, you have to spread the labia. So spread the labia, front to back. And then I already used this up. What I'm going to do is I'll put this on here, so I will know that I already used that. Now this is just going to be water. Wring that. This is the rinse. Same thing, front to back on the side. The other one is front to back on the other side. This one's going to be for the middle. So spread the labia, middle, front to back. So I already got that. Now I'm going to dry. What I'm going to use to dry is this towel. Now I will use this part of the towel. It's just clean out, soap, and then rinse this to dry. So I'll fold it this way, and I'll use this side here from the front. So I'm just going to dab it dry. Okay, and at this point, I know that I use this side here. I will fold that to the other side, and I know that I'll use this for the behind. Okay, so I can put it on the side here, so I know that I already used that. Okay, so at this point, what I'm going to do, by the way, I should have my other towel here while I was doing that. Make sure she has that towel, similar to the catheter care. All right, so what I'm going to do now is I will get ready for Miss Mary to go to the other side, but I need to change my gloves because I'm going to be cleaning the other side. Just remove that carefully, and then definitely put that other soil in the trash can. I'll always sanitize after that. Okay, and then I'm gonna move Miss Mary to the other side. At this point, I can have my other gloves. This is the second glimpse now. Okay. And what I'm gonna do is first bring Miss Mary closer to my side and then turn her to the other side. Okay, Miss Mary, close to my side, pull it by the shoulder. Second is by the hips. And then third one is by the legs. Okay, at this point, I can just casually drape her like that. Okay, practicing body mechanics. Okay, Miss Mary, pull to this side here, and then this side, and move it this way. Okay, so now I can put the towels again. Hold on, Miss Mary. Make sure she clip it in there. Okay, very good. Now, I'm gonna have to reposition the bed pad completely. Now, while on her back, I will check the back, scan the back for any abnormalities, redness, bleeding, or anything, any sign of bed sores. So I just have to clean that. Okay, so at this time, first washcloth with the water, bring that, soap, lather away from the water. And then I'm gonna go same thing, front to back. Front to back is from here to back. Not too far all the way to the back. So, and then go to the, switch that. This side, front to back, and then the other one, switch front to back. Okay, very good. Now I'm gonna put it here. This one is to rinse. So ring that, no soap, because this is gonna be a ring. Front to back, and then the other side, lower region, front to back. This one's gonna be on the middle, front to back. It's the same, and I'm gonna put this right here now. Okay, very good. Now I'm gonna dry it. Now remember, I used the other side for the front, this for the back. Just dry, just water. Okay, very good. Now it's done. I can put it here now. I've used them all up. What's gonna happen next is I'll take this off while in that position while I'm here. So just casually take it off and then put in the trash can, okay? And then make sure it's away from your uniform. So at this point, you can go ahead and have Miss Mary face this side, okay? And you can take care of these things. Okay, so what you do is just to raise this a little bit here. There you go, something like that. She's covered with this one, and then you can get, okay, Miss Mary, we can go on this side now. So go. Position herself a little bit there. You can put the kumot. Something like that. Okay, so it's not that have to be super nice yet, as long as she is covered. Okay, Miss Mary, I'll be right back. So what I'm gonna do is put these items here, this one and this one. Miss Mary, I'm just gonna put away my supplies. You have your call light there if you need anything. Wash, rinse, and dry. Put in a designated area. Now with all these towels, and it's gonna say put them on the soiled linen basket. And at this time, I can remove this. So yeah, I will remove that. And then I'll also have to put that on the trash can, trash basket. And then I'll definitely sanitize my hands. So at this point, remember I have a towel here. I can just pull that away from her. Okay, Miss Mary, so I'm gonna make sure you look nice in here. And let me just grab my towel here on this side. Okay. Oh, so okay, Miss Mary, raise your buttocks again. Okay, there you go. Then I'll put this away into the soiled linen basket. Make sure it looks nice. Remember, you don't have to leave her with a new bed pad, or you don't have to put on any new brief or pull-ups. You don't have to worry about that. So as long as she is looking nice, okay, Miss Mary. All right, so at this point, and she looks nice, and then I'm ready to go, ready to wash my hands. But before I go, we just unlock the bed is in the lowest position. Call lights within reach, Miss Mary, if you need anything. Then of course the curtains you want me to keep open, or keep closed or open. She wants it open. You need a magazine, a TV remote. She wants a magazine, so I'm just gonna give her QR code magazine for you, Miss Mary. Okay, and at this point, I'm ready to go, and I will wash my hands and document. So yeah, so straightforward.